coming back in again. We got your blood work back, your lipid panel, okay? I just wanted to go over some of it with you.
Okay.
All right. Right here it shows your total cholesterol. This is your triglycerides. That's what's highly associated with an increased triglyceride, increased risk for heart disease. And you see that's pretty high right now. Your high density lipoproteins are your good cholesterol, and that looks great. Your low density lipoproteins are the bad cholesterol, and as you see that's high as well. I know. So I wanted to go over some things with you, okay?
Okay.
Now, so we would at this point say that you do have high cholesterol.
What would cause that, considering I'm relatively very healthy and I exercise every day and eat well?
All right, let me show you something here. I've got a little pamphlet. Right here, if you're following a recommended lifestyle, like a healthy lifestyle and everything else, but your LDLs, which is those low density lipoproteins, are still high, there may be another option for you. Risk factors of heart disease and stroke are often associated with high cholesterol, high blood pressure especially, diabetes, being overweight or obese. I mean, none of these seem to associate with you, but if maybe you have a family history of heart disease. Not exercising, but you say you do, heavy alcohol use, poor stress management, your age is great, and maybe if you smoke, that could also be a risk that could be contributing to this high cholesterol. Okay? So what they may do from now is actually put you on a statin drug. Statin drugs are commonly prescribed in medicine, and they're shown to reduce the risk of heart attack and death. Let me show you this here. In patients with coronary artery disease, and they also prevent or reduce the risk of cardiac events in patients with high cholesterol. You are healthy, but I mean, this can definitely happen to you, and there's also other, beneficial effects that could come from taking statin drugs. And some of those are reducing the size of plaques in your arteries, stabilizing plaques, reducing inflammation, reducing your CRP levels, and decreasing blood clot formation. They can also help prevent cataracts. They can be a benefit in diabetes, and they can also reduce your blood pressure. I mean, so there's tons of things that they can help with. So maybe if you have high blood pressure now, a statin drug would also help with that.
Okay, so what are these, what does it actually do in my body?
What it does, says it right here, they improve your blood cholesterol levels by primarily inhibiting a liver enzyme called HMG-CoA reductase, which is your coenzyme A reductase, thus reducing your liver's ability to make cholesterol. Statins cause a significant reduction in the bad cholesterol levels, which as I said, which was those LDLs, moderate reduction in triglyceride levels, which is what you need, and a small increase in the HDL cholesterol, which is that good cholesterol. So, I mean, overall, they're going to help you out there.
Okay, now what if these statin drugs don't work for me? I don't like taking pills very much, and if it's not working, do I get to get off of them? Or?
Typically not. If your statin is not lowering your cholesterol, your doctor may first try to suggest either increasing your dose or changing the statin you're currently taking. In some cases, one medication will not be effective, and a different one may be substituted or added. Okay? I wanted to tell you some of the commonly prescribed statin drugs. Many of those are Lipitor, Crestor, Zocor, and all of these, you see these other names here? Those are the generic names. Those are the statin. Okay? And that's probably what you'll be prescribed whenever you go and visit your physician. Some things that I did want to talk to you about were adverse reactions or side effects of taking a statin drug, because I want you to be completely aware of what they could be. A lot of times they cause GI, which would be like stomach problems, including nausea, gas, upset stomach. Less common, but they could still happen, would be the headache, diarrhea, rash, sleep disturbances. I mean, there could be many things. There are more serious, but typically they don't happen. I mean, the chances are very low. Do you have any more questions for me on that?
I don't think so.
Okay. I wanted to give you this. Also, I wanted to tell you about changing your lifestyle. I mean, you say that you eat healthy and you exercise and everything. I don't know if you smoke, and you don't need to tell me, but I just wanted to let you know that if you do smoke, that can definitely be contributing to the cholesterol. And the way you manage your stress can also be a contributor, okay?
Okay.
All right. Can I help you with anything else, or do you feel knowledgeable on cholesterol?
I feel pretty knowledgeable right now.
Okay. I want you to go ahead and take this with you. I went ahead and printed it off. That's your blood panel, and you can take it to your doctor, and he'll go ahead and get you prescribed that medication,
Awesome, thank you,
Alright.
Nurse Lady.
No problem. Thanks, Emily. Have a good day.
Have a good day.